It was Halloween 1979, and opening night of Hickory, North Carolina's Little Theater play Dracula, a romantic comedy. I had the lead role of Dracula. At the time, I had just opened my first dental practice just west of Hickory. I think they gave me the lead role because I told them I could make my own fangs, which I did, and were a big hit. Little theater performances in small towns like Hickory are crowd pleasers. Weeks before we opened, our theater troupe did a public relations event. We bussed our way to Catawba Valley Mall, where we joined the Red Cross Bloodmobile in its annual blood donor drive. We all dressed up in our costumes, and I prowled around the Red Cross trailer, rousing the little kids who joined in the fun. Opening night was a smash. We got a standing ovation from our audience, who probably had no real talent in evaluating good theater, but we still appreciated their delight. The play ran for 2 weeks. I wish it had run for 1. You see, after opening night and the next few nights, things get old, especially backstage. Backstage is not pretty. It reeks of pot and musty old curtains. Spooky things happen backstage. Mics that work perfectly suddenly stop as the curtain rises. Actors go blank moments before they make their appearance. Things disappear, then reappear. Illicit romances spawn in secluded backstage nooks. I'm telling you, backstage will change a man. It's no wonder that legends of backstage phantoms of old opera houses still exist to this day. Patrons don't see the backstage, only the front stage. That's where everything looks bright and fun. Front stage is where the action is. Backstage makes it all happen. Dental practices have a front and back stage too. Front stage is patient experiences, things they see and hear. It's their relationships with cheery front desk team members and eager hygienists. It's the decor, saltwater aquariums and consultation rooms with track lighting. And of course, it's their treatment experience. A big part of their front stage experience is having confidence that they're being well cared for. Front stage is where the action is. Backstage makes it all happen. Sterilization areas and labs, private offices, staff lounges, mechanical rooms. And just like in theater, spooky things happen backstage in dental offices. Compressors stop working for no reason. Crowns find themselves in the wrong case pans. Team members experience surges of mood swings. But the backstage quirk, most mysterious, is where treatment planning occurs. It's here where dentists design treatment plans. It's here where dentists choose the standard of care their patients receive. It's here where I believe the phantom of the operatory lurks. The phantom is our fear. It's dentists' fear of offering complete care, fear that presenting complete care will overwhelm patients or lose them from sticker shock. We all know treatment plans should offer patients complete dentistry, revealing all conditions and consequences if untreated. We know to discuss the benefits, risks, and alternatives to care. It's during backstage treatment planning the phantom, our fear, exerts its malice. Too often, dentists acquiesce to the phantom. Complete treatment plans are sacrificed to a shadow of what they could have been. The concept of complete dentistry has been around for as long as I can remember. To clear things up, complete dentistry doesn't necessarily mean complex dentistry. For some patients, depending on their conditions, complete care may be a simple cleaning or a 2-surface composite, or for my Canadian friends, a 2-surface composite. Some patients, complete care is full mouth reconstructions. Complete care is the minimum amount of dentistry needed to restore patients to optimal function, comfort, aesthetics, phonetics, and airway. Now, that definition isn't mine. It's been around forever, and it has a nice ring to it. But do most dentists believe it? Do they do it? Or do they just pay lip service to it during study club meetings? I've done anonymous surveys of thousands of dentists during my seminars for over a decade. I ask audiences this question: how many of you are reluctant to offer complete dentistry out of fear of overwhelming patients or losing them from sticker shock? Guess what? Over 70%, 70% of audience members, thousands of them, are fearful of offering complete care. 70%. We all know offering complete care is the right thing to do, but most of us don't do it. It's the phantom, it's fear that stops us. As a result, too many patients never experience the front stage of complete care. To foil this phantom, to defeat our fear of offering complete care, requires us to rescue the concept of complete dentistry, rescue it from the dim backstage treatment planning areas, and invite it into the light of front stage experiences. I'm telling you, muster the courage to do what's right. In light of COVID-19, the traditional definition of complete care is no longer enough. Complete dentistry now is more than just the operational aspects of dentistry. It must now include reducing patients' systemic risks to COVID-19 during treatment. You can restore a patient's mouth, but if they become sick in the process, complete care has not been delivered. Reduction of systemic risks must be included in the new definition of complete care. Restoring patients to optimal function, comfort, aesthetics, phonetics, airway, and systemic safety. Just about everything I read in my inbox about reopening practices is about new guidelines for COVID-19 prevention. PPEs, room evacuation systems, N95 masks, you know all of that. The big picture here is COVID-19 guidelines have created significant inefficiencies in modern dental care delivery. No longer are we going to enjoy the efficiencies of hopping from chair to chair. Treating multiple patients simultaneously may cause more harm than good. Use of ultrasonics, air water syringes, high-speed air turbine handpieces are no longer worry-free. Compounding this are room sanitation recommendations that will slow the treatment process down to a crawl, and maybe, for now, make high collection days a thing of the past. So, how does rescuing the concept of complete dentistry out of the backstage and bring it to the front, how does it solve any of this? Well, here's how. I recommend telling new and existing patients up front, before any clinical procedures, that coronavirus infection prevention has changed healthcare and the dental treatment process. They'll understand this. They see it every day on TV. You also tell them that during your examination, you'll look for all dental conditions that could become worse or contribute to any pre-existing medical condition. As you know, there's plenty of real evidence about the oral systemic link. You see, this conversation initiates the process of bringing complete care to the front stage. Following this upfront conversation, do a complete exam. Then assemble a plan of care for complete dentistry and present it. Start your presentation by telling patients the benefits of the care they'll receive. Then fully deliver the concept of complete dentistry to your front stage. Explain that your responsibility now is to recommend complete care, care that will safeguard their ease of eating, comfort, appearance, speech, ability to breathe during sleep, and guard them from COVID-19 infection. Tell them you'll reveal all conditions you see and recommend complete care. Tell them there may be some conditions they won't be concerned about. Whether they choose to treat them will be their choice, but you see, you don't have a choice. Tell them you've always had the responsibility of keeping them safe and comfortable during treatment. However, now, the standard of safety and comfort is much higher. Tell patients you recommend treating their conditions in the fewest number of appointments to reduce their COVID-19 risks. Tell them this means longer treatment appointments, completing as much of their care as possible. Patients will appreciate you taking the time and leadership initiative to do this. I'd say to each one of you, recommending complete care is the new standard of care. Now, here's how all this sounds. Let's imagine you have a new patient, Hank. He's seated in a consultation room or an operatory, and you start. Hank, welcome to our practice. How can I help you today? Well, Doc, I got something going on here on my back teeth on this lower right side. It doesn't bother me until I eat something, and I just don't want it to get worse. Hey, I understand, Hank. Is there anything else that concerns you? Well, Doc, it's been a while since I've been to the dentist. I guess I need a cleaning too. Okay, Hank. You know, I see in your record you work at Taylor Transportation. How have things been there? Well, Doc, it's been tough. A bunch of the guys were laid off. I was lucky. I wasn't. What do you do there, Hank? Well, I'm a long-distance driver. My run is from here to California and back, hauling produce. Oh, good for you, Hank. I appreciate you hanging in there. I'm sure a lot of other people do too. Thanks for that, Doc. Hank, coronavirus prevention has changed healthcare and dental treatment. Today, during your exam, I'll look for all dental conditions that could become worse. I'll look for anything that could contribute to pre-existing medical conditions. Hank, looking at your medical history, I see you have high blood pressure and diet-controlled type 2 diabetes. As you know, coronavirus is opportunistic for people with pre-existing conditions. Yeah, Doc, I know. I need to be careful. Now, I do a complete exam, and during the exam, I would talk with him. I would learn which conditions he's concerned about and those he isn't. After the exam, I assemble a treatment plan for complete care, including conditions he's not concerned about. During my treatment presentation, I'll have my patient advocate present. She's what most dentists call a treatment coordinator. Here's how my treatment presentation for complete care sounds. Hank, I can see why this area on your lower right is a problem for you. And you're right, we don't want this area to get worse and get in the way of your driving. Let me introduce our patient advocate, Ginger. She's the expert on helping patients fit care into their schedules and into their budgets. You two will have a chance to talk when you and I are finished. Hank, because of the risks of COVID-19, my responsibility now is to recommend complete care. Care that will help you eat without discomfort and guard you from COVID-19 infection. Today we'll talk about all conditions I'm concerned about. Now, there's going to be some conditions, Hank, that you're not going to be concerned about. Whether you choose to treat them is your choice, but you see, Hank, I don't have a choice. I have always had the responsibility of keeping patients safe and comfortable during treatment. However, now the standard of safety and comfort is much higher. Well, thanks, Doc. I'm all for that. Hank, I recommend we remove the broken fillings and cracked enamel on 2 teeth on your lower right side. We'll cover them with an enamel-like material. It's called crowning the teeth. Now, at this point with Hank, I would show him some before and after photos of posterior crowns, maybe on an iPad or something like that. Then I'd continue. Hank, you mentioned you're not ready to replace the missing teeth on your lower left side and straighten the crowded lower front teeth. I understand. When you're ready, I recommend we replace the missing teeth with dental implants. We can straighten the lower front teeth with removable aligners. We'll talk more about this when you're ready. Hank, it's important that we treat you with the fewest number of appointments to reduce the COVID-19 risks. I recommend we treat your lower right teeth and do your cleaning all in one long appointment. You'll be with us for about 3 hours to do all of this. The fewer return appointments you need, the safer you'll be, Hank. What questions, what comments do you have for me? You see, at this point, I'd handle technical questions. As questions about fees and insurance come up, I'll hand off to Ginger, my patient advocate. In light of massive unemployment, along with patients losing their dental benefit plans, you'll be tempted to retreat from offering complete care. Don't do it. If it isn't the right time for patients to accept complete care, they'll tell you. Let it be their decision, not yours. Yes, expect more patients than ever not to be ready for complete care. But by not offering it, you're back into collusion with the phantom. Like it or not, COVID-19 can be a turning point for you. You can choose to grow out of your fear-based thinking about complete care. It could be COVID-19 is the nudge you need to bring complete care back to your front stage. I'd say to each of you, recommending complete care is the new standard of care. Now, I know, I left a lot of loose ends here. You're probably asking, well, what about this or what about that? I can't get into everything in this video. Regardless of the loose ends, don't miss the main points here. Number one, most dentists don't recommend complete care out of fear of overwhelming patients and losing them from sticker shock. Number two, introduce patients to the concept of complete dentistry early in their appointment. Remind them why it's important now to eliminate dental conditions that may aggravate pre-existing medical conditions. Number three, dental regulatory agencies and associations have established guidelines for preventing the spread of the coronavirus during patient care. Number four, these guidelines will diminish the efficiency model of seeing multiple patients simultaneously. It slows the turnaround time of dental operatories from one patient to the next. Number five, while staying within the standard of care, provide the maximum number of procedures per appointment. This will help compensate for dental care delivery inefficiencies brought on by regulatory agency guidelines. As tragic as the coronavirus has been, it's created an excellent opportunity for us to rethink our relationship with complete dentistry. Rescue the concept of complete dentistry from the backstage of your office and bring it to the front. Tell patients about its benefits. Do it early before any clinical procedures. Then revisit it during treatment presentations. Link complete dentistry and minimal return visits to safeguarding patients' safety and comfort. I mentioned before, I'm leaving you with some loose ends. Now, if you want to tie them up and would like all the details on presenting complete care with no fear of overwhelming patients or losing them from sticker shock, visit my website at www.paulhomily.com. Check out my 2 online programs, Making It Easy for Patients to Say Yes and Case Acceptance Skills for New Dentists. Now, I didn't design these programs with worldwide pandemic in mind. It's serendipity that they have become the resource whose time has come. My hope is when the acute threat of the coronavirus is over, that dentists continue bringing complete dentistry to their front stages. Let's set free the phantom of the operatory, free to retreat back to 19th century opera houses where he belongs. Remember this, recommending complete care is the new standard of care. Thanks for listening, and be safe.